Join me as I dig deep into the warning signs of multiple myeloma and see if I can identify them all before time runs out. Multiple myeloma is a type of blood cancer that often flies under the radar. It's a complex condition that affects the plasma cells in the bone marrow, hindering their ability to produce healthy antibodies. As a result, the body becomes more susceptible to infections, and the bones become weaker. Despite its significance in health discussions, multiple myeloma remains poorly understood by many. One of the primary reasons it's essential to learn about multiple myeloma is that it's often diagnosed at an advanced stage. This is because the symptoms can be subtle, and they're often mistaken for those of other conditions. As a result, thousands of people are living with undiagnosed multiple myeloma, unaware of the severity of their condition. The good news is that by educating ourselves about the warning signs of multiple myeloma, we can empower ourselves to take control of our health. By being proactive and recognizing the symptoms early, we can improve treatment outcomes and increase the chances of survival. Multiple myeloma is a complex condition that requires a comprehensive understanding. In the following video, we'll delve into the early warning signs, symptoms, and risk factors associated with this type of blood cancer. Recognizing the early warning signs of multiple myeloma can be challenging, even for medical professionals. The symptoms can be vague and may not seem related to cancer at all. It's not uncommon for people to experience a range of symptoms before receiving a diagnosis. In fact, many people are diagnosed with multiple myeloma after visiting their doctor multiple times for seemingly unrelated issues. The lack of awareness around multiple myeloma contributes to the difficulty in recognizing its early warning signs. Because it's a relatively rare condition, many doctors may not consider it as a potential diagnosis. Unfortunately, this means that people may experience a prolonged period of undiagnosed symptoms, which can significantly impact their quality of life. One of the primary reasons multiple myeloma is difficult to diagnose is that its symptoms can be mistaken for those of other conditions. For example, anemia, a common symptom of multiple myeloma, can also be caused by iron deficiency or chronic bleeding. Similarly, bone pain, another common symptom, can be caused by osteoporosis or arthritis. As a result, it's essential to be vigilant and aware of any changes in our body. If we're experiencing persistent or recurring symptoms, we must advocate for ourselves and push for a thorough diagnosis. The difficulty in recognizing the early warning signs of multiple myeloma is further compounded by the fact that it can affect anyone. While certain age groups and demographics may be more susceptible, anyone can develop multiple myeloma. This means that we must all be aware of the symptoms and take proactive steps to protect our health. Despite the challenges in recognizing the early warning signs of multiple myeloma, there are steps we can take to empower ourselves. By educating ourselves about the symptoms and risk factors, we can take control of our health and improve our chances of early detection. The key to recognizing the early warning signs of multiple myeloma is to be aware of our body and any changes that may occur. We must listen to our body and advocate for ourselves if we're experiencing persistent or recurring symptoms. Multiple myeloma is a complex condition that requires a comprehensive understanding. By delving into the risk factors and symptoms, we can gain a deeper appreciation for the importance of awareness and early detection. One of the primary risk factors for multiple myeloma is age. The majority of people diagnosed with multiple myeloma are over the age of 65. However, it's essential to note that anyone can develop the condition, regardless of age. Family history is another significant risk factor for multiple myeloma. If we have a family history of the condition, we're more likely to develop it ourselves. This is because certain genetic mutations can increase our risk of developing multiple myeloma. Additionally, people who have been exposed to certain chemicals, such as benzene or pesticides, may be more likely to develop multiple myeloma. Similarly, people who have been exposed to radiation, either through medical treatment or environmental exposure, may also be at a higher risk. The symptoms of multiple myeloma can vary widely from person to person. Some people may experience a range of symptoms, while others may experience only a few. Anemia, bone pain, and fatigue are some of the most common symptoms of multiple myeloma. Anemia is a common symptom of multiple myeloma, characterized by a decrease in red blood cells. This can lead to feelings of fatigue, weakness, and dizziness. In some cases, anemia can be severe, resulting in shortness of breath, pale skin, and rapid heart rate. Bone pain is another common symptom of multiple myeloma, caused by the abnormal growth of plasma cells in the bone marrow. This can lead to pain in the back, hips, or other bones, as well as weakened bones that are more susceptible to fractures. Fatigue is a debilitating symptom of multiple myeloma, characterized by feelings of exhaustion and lethargy. This can make it difficult to perform daily tasks, enjoy hobbies, or maintain social relationships. Recurring infections are also a common symptom of multiple myeloma, caused by the abnormal growth of plasma cells in the bone marrow. This can lead to frequent illnesses, such as pneumonia or bronchitis, which can be severe and potentially life-threatening. One of the most heartbreaking aspects of multiple myeloma is that it can be silent, allowing it to progress undetected for months or even years. This means that people may not experience any symptoms until the condition has reached an advanced stage. Let me share a powerful anecdote that highlights the importance of awareness. Sarah, a 52-year-old mother of two, was experiencing persistent back pain that she attributed to her busy lifestyle. Despite visiting her doctor multiple times, she was told that it was simply a result of stress and was prescribed pain medication. However, when the pain persisted, Sarah began to experience other symptoms, including fatigue and recurring infections. It wasn't until she was diagnosed with multiple myeloma that she realized how crucial it was to listen to her body. Sarah's story is a powerful reminder of the importance of awareness and early detection. By being proactive and recognizing the symptoms of multiple myeloma, we can improve treatment outcomes and increase the chances of survival. Sarah's story is not unique. Many people have experienced similar journeys, often being misdiagnosed or told that their symptoms are simply a result of stress or aging. However, by sharing our stories and raising awareness, we can empower others to take control of their health. The warning signs of multiple myeloma are complex and varied. By educating ourselves about the symptoms and risk factors, we can empower ourselves to take control of our health. It's essential to remember that awareness is key, and by being proactive, we can improve treatment outcomes and increase the chances of survival. In conclusion, recognizing the early warning signs of multiple myeloma is crucial for improving treatment outcomes and increasing the chances of survival. By being aware of the symptoms and risk factors, we can take control of our health and empower ourselves to seek medical attention if we're experiencing any unusual changes. I hope this video has provided you with valuable insights into the warning signs of multiple myeloma. If you or a loved one has experienced similar symptoms, I encourage you to share your story in the comments below. Remember to check out our other videos on related health topics. Thanks for watching. So if you found this video helpful, please like, subscribe, and click on the bell for more health tips and updates.